Here is my evidence-based practice poster project on hand washing with soap and water versus alcohol-based hand rub such as hand sanitizer. The purpose of this project is to decrease the transmission of contact infections in patients by using soap and water rather than alcohol-based hand rub. This will hopefully change the current practices in healthcare. The practice problem. Infections are spread by not using soap and water while hand washing. Winter 2015. At a maternity clinic, patient mortality rates were 20% due to group A beta hemolytic streptococcus infections, and healthcare-associated infections are serious complications impacting 2 million patients and accounting for approximately 100,000 deaths per year. Some of the background questions are as follows. What is the number one action to fight against infection? How common are infections? How do we prevent the spread of infection? What is a better method to prevent infection, the use of soap and water or alcohol-based hand rub? I developed the PICO question. The P, healthcare workers in a clinic. I, using soap and water for hand washing. C, using alcohol-based hand rub. O, decrease the transmission of contact infections from 48% to 30% within 6 months. In my evidence-based search process, the databases I used were CINAHL and Nursing Reference Center Plus. Some key words that I used were hand washing, effectiveness, infection, monitoring, and hand hygiene. Some of the inclusion criteria are humans, English, research, USA, and included the dates between 2011 and 2016. The exclusion criteria was that I excluded evidence greater than level 3. And as you will see on the next slide, my research history results. As you can see, I have developed an evidence-based search process table. Based on my research process, I have developed a table of evidence that includes evidence related to my PICO question. The data collected from the studies are study citation and authors, sample, characteristics and size, the design, patient selection, the intervention, the conclusions, the level of evidence, and my comments on the studies. Some of the practice recommendations are as follows. As recommended by the CDC, the duration of time, more than 20 seconds of hand washing with the use of soapy water is more effective in decreasing bacteria. The infection prevention team suggests that the hand hygiene monitoring program using soap and water or alcohol-based hand rub should be implemented to improve hand hygiene compliance rates. The IRB involvement. The studies I found did not provide sufficient evidence in the comparison of hand washing with soap and water versus alcohol-based hand rub. Therefore, the results are inconclusive. The evidence did, however, show that the use of soap and water for hand washing is most effective in decreasing infections. Therefore, the Evidence-Based Practice Committee needs to seek and gain IRB approval. The Stettler model for implementing the protocol was used. Phase 1. The purpose and importance of hand hygiene was explained. Educational materials such as pamphlets and PowerPoint presentations were provided. Information on the cost-effectiveness of hand washing was provided. Phase 2. The data was analyzed for effectiveness and efficiency. Phase 3, the data was organized and reliable. Meetings were held monthly and quarterly for the staff. In Phase 4, implementation and monitoring the compliance of hand washing, and the compliance rates will increase from 50% to 90%. Phase 5, evaluating the outcome. Within 6 months, contact infections will decrease from 48% to 30%, with more than 80% hand washing compliance with soap and water. Methods for evaluating the practice change. The change will be assessed by observing the compliance of hand washing using the electronic hand hygiene monitoring tool. This tool reminds the staff to wash their hands if they forget to wash their hands before leaving the patient's room. There will be a discussion of compliance reports monthly and quarterly with the staff. How the practice change will be sustained. Collaboration with the healthcare team, attending monthly and quarterly meetings with the staff, having continuous feedback, and accepting opinions and ideas on ways to improve the change.